Hi everyone, Alexandra here with MDPen. Thank you for tuning in for today's YouTube live video. Yesterday was National Vitamin C Day, so today I wanted to talk to you guys about Seaplaning with MDPen. And this is a patent that we actually came up with that combines Dermaplane with using our vitamin C and E brightening serum. As we move from winter to spring, a lot of people still have residual dry skin. Perhaps they recently had a microneedling treatment done a few weeks ago. Dermaplane can be the perfect manual exfoliation to kind of help move this dead skin along. I encourage you guys at the 2-week mark, when you are doing facial anti-aging microneedling, to bring in that patient at the 2-week mark and do this seaplaning. Now, the only type of patient I would not recommend this for would be someone who is very oily and very acne prone. That would be the patient type. If someone has normal or dry skin, even combination skin in most instances, this procedure will be safe for them and highly effective. So for those of you that are not familiar with our vitamin C and E brightening serum, it has 2 forms of vitamin C in it. This is a high potency vitamin C. It is a 21%. We also put vitamin E in here, and we have ingredients like licorice and green tea that help even more with that nice lightening and brightening effect. There's also an ingredient in here called Nutrizen that we added to help make this especially safe for patients with rosacea or perhaps more of a sensitive skin. So a lot of times those patient types tend to avoid vitamin C. This is one they can use without feeling irritated or anything like that. So for most of you, especially those of you that are estheticians, you are familiar with Dermaplane. Perhaps you already offer it within your practice. I brought a couple examples of Dermaplane Blades. This is going to be a disposable here. You've got your 10 blade on there. And then, of course, you have a surgical tool Dermaplane blade here. Now, I do want to reiterate that even if you are a licensed esthetician, you do need to receive proper training before Dermaplane. So do make sure you check that out somewhere. If it's not offered already within your practice, perhaps someone higher up from you, another esthetician can mentor you, train you. Perhaps your physician wants you to have an actual certification from a class. You can definitely find those. A lot of peel companies will also offer Dermaplane classes. So you can definitely look into that. But these are 2 types of common Dermaplane blades. I personally had always dry dermaplaned probably up until 2018, 2019, when I familiarized myself with oil planing. And I wish I had known about it sooner because, as you guys know, when you dermaplane someone with dry skin, it's almost like a tacky feeling where you can almost feel the blade sticking to the skin or kind of like getting caught up on the skin. So that's when it's nice to have the option of oil planing, even on someone with normal skin. Again, if someone has oily skin, you can definitely just dry plane them. You're going to have no problems. But for dry skin, normal skin types, this is going to be perfect. If you're also dermaplaning someone who is prone to hyperpigmentation or has hyperpigmentation, you can do a great thing by doing the seaplaning with them with our vitamin C and E serum. Now, of course, I don't have a live patient with me today, so I have my mannequin head here, which I'm just going to kind of show you guys. So obviously our C and E serum does come in a dropper, so you can definitely dispense this. Perhaps you have like a little plastic peel cup or something like that. A dish that you can sanitize, and you can just go ahead and drop this right into there. If you are dropping it onto the skin, make sure you are not touching the skin with the end of your dropper. So in most instances, you'll be sitting behind our patient as I am with my mannequin here. So you'll just be like this. But if you are dropping it on the skin, again, do not touch the skin with the dropper. That's why I recommend dropping it in advance. So you can apply the vitamin C and E serum onto the skin. And for those of you that are already oil planing, this will come very easily to you. Even people that dermaplane dry, you're basically just adding the vitamin C and E serum. A little bit goes a long way, guys. This is a very emollient serum, oil-based. And again, you hold it here, you're dermaplaning, and you're going up on the skin. It is gorgeous. As you do it, with dermaplane, you always see the skin brighten, but by adding the vitamin C and E brightening serum, you're going to see even more of like a really luminous effect as you're dermaplaning the skin. And this is a very affordable vitamin C and E serum. At 21%. This is $70, guys, retail. So I would include it in the treatment. And if you're a patient who gets dermaplane done from an MDPen provider, ask them to use this. Buy it at the time of the treatment, and then you'll have it, and you'll be able to suppress pigment between visits. And everyone needs to be on a vitamin C and E. Even if you don't have hyperpigmentation, this protects you against environmental damage, UVA, UVB. Again, gives a natural lightening, brightening to the skin, also going to boost, and you have all those nice antioxidants in there protecting your skin. So you can definitely dermaplane, again, with the vitamin C and E. We call this seaplaning. So if you are interested more in seaplaning, you can definitely go to the MDPen website. If you want to become a serum provider with us, you do not have to carry MDPen, our device, in order to carry our products. I'd be happy to talk to you more and educate you about our skincare. And again, our vitamin C and E serum, you've got to have it, guys, if you're doing dermaplane. Let me go ahead and open it for Q&A. Please ask any questions that you guys have. If there's something you currently use for dermaplaning or oil planing, a certain product, I'd love to hear about it. Any experience that you've had. Do you prefer dry planing? Do you prefer oil planing? What are things that you're looking for to see within your practice? Again, you could definitely bundle dermaplane treatments with your microneedling series, having them come in at that 2-week mark, help that dead skin along. And again, we're spring cleaning. Let's get all that dead skin off from the winter months. All right, I see some questions here. All right, hi, honeybee. So you do not want to necessarily, you don't typically need vitamin C in the evening. And a lot of times in the evening, we're wearing retinols, tretinoins, retin-A, retinaldehydes, alpha hydroxy acid products, things like this. So it's better to wear the vitamin C product in the morning and not mix them with that. Also, just because we are talking about microneedling, since we are a microneedling company, do not use vitamin C at the time of microneedling, and do not use it the 2 days prior to microneedling. There is a risk for granulomas, guys, and we have seen things happen. So do not use vitamin C with microneedling. Can dermaplane cause ingrown hairs? The short answer is it shouldn't. Now, this is why it's so important to be trained on dermaplane and why you need to be a professional. I know they offer dermaplane in beauty stores now, and this is not the same thing. Unless you're getting a surgical 10 blade, you are not getting dermaplane. So those things that we use for like little eyebrow hairs, I don't use them because they do cause ingrown hairs. Do not use those on your face. You will absolutely get ingrown hairs. If you're prone to acne, you will get acne. You'll get pimples from the ingrown hairs. So you want to avoid this. This is why dermaplane is done with a single blade. And again, people that are trained in dermaplane know the direction to use it, the angle of the blade, the way to go on the face. And it's much better to have someone else do this treatment on you. So yes, it can. So make sure that you have a professional doing the treatment. What is the difference with using oil and vitamin C with dermaplane? So when you're using just typically a dermaplane oil from perhaps like a dermaplane company, that's all it is. So it's not really going to hurt the skin. It's not really going to help the skin. With this, you are obviously not infusing vitamin C into the skin, but what you are doing is giving that nice manual exfoliation. So the product is going to absorb, is going to penetrate better, and you are helping it along at the time of treatment. Again, it's not really worth doing unless the patient is going to use the vitamin C at home. So make sure that you're retailing it. Make sure that they are using a vitamin C and E serum at home. Hopefully it's ours. Again, ours is very affordable. There's vitamin C and E's, I won't say similar, but in the same category as ours on the market that are over $150. So ours is very affordable at $70. Can vitamin C serum be used for dark circles? You can use it in the infraorbital area. Yes, the green tea and licorice can often help with that caffeine component. So yes, you can. I would also encourage you to use our Tighten and Lift serum for that extra boost of green tea surrounding the eyes. If you need, help beyond that, sometimes you have to find obviously the cause of the dark circles, if it's allergies, genetics, if the area is, a bit emaciated, losing fat pads there can be other treatments needed. But yes, absolutely. You can tap it all around the infraorbital area, and the dark circles, do not use it on the upper eyelids. Can you layer vitamin C with a sunblock cream? Yes. So after you've done the Dermaplane treatment with Seaplaning, even if you're just using vitamin C at home, you can end it the way you would an MDPen facial, which I've talked about. We have some videos on our social media about, but basically after you've dermaplaned, you can definitely go in with the HA copper mist and mist them down. And next you can apply the Revita Peptide Moisture Cream and massage this really nicely into the skin. Last but not least, you would put sunscreen on over it. For people that don't need the extra component of the cream, you could just go straight from vitamin C to sunscreen. Most people like the benefit of the Revita Peptide, of the peptides, of the amino acids, of the growth factors, squalane, HA. So all of that would be within your Revita Peptide cream. So next you would add your sunscreen. Yes, absolutely wear sunscreen over your vitamin C and E. It does not make sense to wear an environmental protectant if you're not wearing vitamin C over it to protect yourself. Again, guys, copper mist can also be used at the end. So after you've applied that sunscreen, you can also use it to lock in all that nice moisture to the skin. It's not just used on dry skin or in place of a toner. It can be used to lock in skincare products. So at the end of the regimen, this can also be used. How often should I get a Seaplaning treatment? Yeah, so this ideally would be done monthly. You don't want to dermaplane more often than every 4 weeks. So if you're not someone who's having microneedling done, you can have it done at the time of your monthly facial. Or those of you that make the Seaplaning treatment into a facial in itself, that would also be a monthly treatment. If you are coming for microneedling monthly, do that dermaplane in between at the 2-week mark with the Seaplaning. Thank you guys so much for all of these questions, engagement. There's that link in there for how to end a facial with MDPen products. For those of you that aren't familiar, and the C and E is a part of that. So copper HA mist, vitamin C, Revita Peptide, and sunscreen. Perfect way to end a facial. You can find all of those products on our website. Yesterday, again, was National Vitamin C Day, which I'm so glad that we have, because vitamin C should definitely be talked about and be a part of everyone's regimen. For next week on Tuesday at 10 a.m. here on YouTube, I will be talking all about our hydrating cleanser from MDPen and how it is the perfect cleanser for all skin types. And you cannot say that about many cleansers on the market. So I'll be excited to talk to you guys about that and explain why it's such an amazing cleanser. I see one more question. How long should I wait after applying CE serum? If you're still talking about the sunscreen, you don't have to wait long. So pat in the vitamin C and E. 4 to 5 droplets should be plenty to cover the face. With 5, you can probably get further down, into the neck area. You don't have to wait long. It's going to absorb pretty quickly. Put on that Revita Peptide and then follow with your broadband SPF 30. If you're someone who's very impatient or is in a big hurry in the morning, you can just put the SPF 30 and the Revita Peptide together on the back of your hand and just put them on. If you don't like waiting to layer, that you can do that. Absolutely. So thank you guys again for all those questions. I will see you next Tuesday at 10 a.m. here on YouTube to talk about the MDPen Hydrating Cleanser. I'll see you guys then. Please like this video and follow our account if you're not already. Bye, guys.